Well, hello, everybody. My name is Michael, and I will be your moderator today here for our webinar. And we are joined by our surgeon, Dr. Purnima Patel. Dr. Patel, how are you today?
I'm feeling good. How about you?
I am wonderful. Let's get this in slideshow mode. There we go. Okay. I'll do a couple quick things. For those of you, first of all, thank you so much for joining us here on the webinar, whether you are watching this live or you are watching the recording. We're very blessed to have you here with us to learn about what vision correction options are available for us that are past the age of 50 years old. And we'll talk about everything from refractive lens exchange, premium cataract surgery. But the most important thing is that any and all questions that you may have about your vision are fair game today. So I'd love to encourage you to familiarize yourself with a little Zoom bar. You'll see there's a more button on my side, and I click it and I can see Q&A. That's where you can be able to click and ask any and all questions that you have about your vision. And then number two is what is a good outcome for you on our time here together? That would be if you'd like to come in and have a free consultation, and we will extend an invitation to you at the end of our time here together after we've gone through questions. Dr. Patel, your amazing photos on the screen, also your credentials, but why don't you just share a couple quick words about your journey and why you love being an ophthalmologist so much, and just a little bit about our practice, please.
Sure. Being an ophthalmologist, I feel so lucky that I kind of fell into it. Part of it is because my dad suffered from a chronic eye condition, and so that was the my door into the field originally. But what a privilege it is to give people the gift of sight. It literally changes how they see the world and how they live in and move through the world on a daily basis. And oftentimes, with the surgeries that we do, we can change people's outlook literally within 10 minutes with the surgery. And that's such a joyful gift to share with our patients. I have been at this current practice, which I started in 2021, for 5 years now. I can't believe that. And then prior to that, I was at Emory for 11 years, working and training with residents and seeing patients at the university and at the VA hospital there. So I'm glad to that you're sharing your time with us today. And like Michael said, we want to answer a lot of questions, make you feel more comfortable and confident and educated about the
Yeah.
whole process of having surgery, especially with us.
Excellent. Let's get into it. I think a really good place for us to start is kind of talking through what's actually happening to our eyes as we are aging. And if you wouldn't mind, ladies and gentlemen, I'm going to put a quick poll into the chat here, if you will. It'll pop up on your screen. Can you just kind of tap in? We would like to know sort of the age of demographic of who we've got here. That'll be very helpful. But Dr. Patel, can we just talk through while people are kind of tapping that in? What is going on with our eyes as we age? Why did our vision start going downhill after the age of 40 or 50? And what's that sort of like, what's going on inside of our eyes, please?
Sure, there's a lot of changes that can occur in the eyes as you get older, but one of the more common natural aging processes is where the lens, which is a tiny magnifier inside of your eye that allows you to focus light on your retina so you can see, that becomes stiff. It's less bendy, and so it doesn't allow you to see up close as easily as you could before. And so in the 40s is when you start noticing it, and that's when we start, because our arms don't aren't long enough anymore, we have to reach for those readers. And the power and the strength of those readers kind of increases as you get older. The next step is that as you get older, that lens not only becomes stiffer, it also becomes more cloudy, and that's what we call a cataract. And when it becomes cloudy, you'll start noticing more effects on your vision where you could need more light to read. You might have glare from oncoming headlights. You may feel like some things have ghosting or doubling of images. And so those are some of the early symptoms that we'll see patients noticing. First in the 40s is that loss of that near vision, or what we call accommodation. And then as the decades stack up, having that decrease in the quality of the distance vision as well.
The gift of our birthdays, right?
Yes.
So let's talk about, you mentioned cataracts. What exactly is a cataract? What's causing them? And is it something that happens quickly, or how long do they take to form? Like, how do you kind of describe what a cataract is and what causes them, please?
So cataract is just a clouding of your natural lens. You can see on this picture that Michael put up there that it's kind of turned yellowish to brown in its most advanced form. And so you'll start noticing more cloudy vision, having more difficulty when you're driving at night because of the oncoming headlights. Even colors, which is a subtle thing, but colors don't seem as bright. And because oftentimes we'll have patients, yesterday we just did surgery and we have several patients that said they had one eye that had been done and the other the eye that had not been done yet. It's coming up next week. That they didn't know that the color of the paint on their wall was white, that they were convinced it was like a cream or yellow. And
Oh,
now they
wow.
can see the difference that how much brighter things look as that cataract is removed. Now, cataracts can form as the natural aging process, and that is, in fact, the most common reason why we'll start seeing cataracts in patients. But certain conditions can predispose patients to having cataracts earlier, like diabetes, especially if the sugars are uncontrolled, or if you have other ocular conditions. Sometimes even excessive exposure to UV light can hasten cataract development. Cataracts are typically slow to develop, but some patients will have a very quick forming cataract. It's a less common type, but that
Yeah.
can happen.
Yeah, and then as I have it on the screen, sort of when you're talking to a patient, when do people typically need to have cataract surgery? What's that tipping point, if you will?
The tipping point is different for different people. It really depends on your daily activities and your vision demands. And so patients will come in not necessarily knowing they have a cataract, but they're knowing that they're having more difficulty with the things they have to do for work or things that they want to do for their enjoyment in life. So that's when we start talking about, we'll do a full examination to see if the cataract is in fact the reason for this decline in vision. And that's when we'll start talking about cataract surgery in patients. But nowadays, some patients are jealous, frankly, of our cataract surgery patients that can have the surgery and not have to wear glasses afterwards. So some patients will choose to have their lens removed before they have a cataract form, so they can take advantage of the new technology lenses that are available and they can get rid of their glasses. And in that case, the surgery is exactly the same, but we call it a refractive lens exchange because we're taking out the natural lens and replacing it with a new lens that allows patients to see at multiple distances without their glasses.
Yeah, and I think that's a good transition point where a lot of people who are, let's say they're in their 50s, and we kind of took a look. There's a vast majority of everybody here is over the age of 50, but how do we sort of talk through what a refractive lens exchange is? We talked about cataract surgery, but what is a refractive lens exchange and why should somebody consider that procedure if they haven't quite got to a point where they have a fully formed cataract, but they're still struggling with their vision? How do you talk someone through what RLE is, please?
Sure. It's to simplify it, I would say the surgery for RLE is exactly like cataract surgery, but the outcome is similar to what patients experience with LASIK when they were younger. So they had LASIK in their 20s and 30s and were able to see far away to drive, what we call intermediate distance, which is like dashboard distance or computer distance, and up close, which is like reading a newspaper or looking at their phone. When we're removing the lens, the natural lens for refractive lens exchange and replacing it with a new lens implant, that lens implant is often a multifocal lens that we use that allows patients to once again be able to see distance, intermediate, and up close their phone without glasses. And the biggest bonus is that they will not develop a cataract in the future because we've removed the lens. There's no lens to turn into a cataract. And so they're done. They're not going to have cataract surgery in their, 60s, 70s, things like that. So that's not one thing not to have to worry about.
Before we go to the next question, and what I wanted to ask is about if you've had LASIK in the past, but I definitely would love to encourage you, ladies and gentlemen, if you have any questions, put them in the Q&A. We'll be able to answer them for you. But the question I have for you, Dr. Patel, is what about those people that have had LASIK? So can they have refractive lens exchange if they've had LASIK in the past?
They certainly can have refractive lens exchange, and it's important for us to know. Usually we can just look in the microscope and tell if we've had LASIK,
Yeah.
but we always ask our patients. But if they've had LASIK, it may change the exact type of lens implant we use. When we're doing an evaluation, whether it be for refractive lens exchange or for cataract surgery, we're doing a complete eye exam, a complete history to get all the information and then select the right lens implant for you. So it's to figure out what your vision goals are, what do you want the outcome to be, and then we'll give you the recommendations that we think best suit your eye. So when you've had LASIK, depending on, and for those of you that have not had LASIK, LASIK is reshaping the cornea to make it so you don't need glasses. And because of that reshaping of the cornea, we really need to map the cornea before cataract surgery and make sure if there's anything we need to account for in our calculations for having cataract surgery. So it may just change what we recommend, but you can certainly still have cataract surgery if you've had LASIK before. Those are often our patients that are, they are spoiled by their LASIK and not needing glasses. And so when they're in their 40s and 50s and struggling with their readers, they don't like it. They have been
Yeah.
living life, for over a decade with no glasses. So having to bring those glasses back is hard and can be challenging for patients and their activities.
Let's try to the flip side of that, which is on the other end, which is if somebody has refractive lens exchange now, does that mean that they will still need cataract surgery in the future? Or sort of how do you describe that to people, please?
So because the lens is what turns into a cataract and we're removing it with the refractive lens exchange, you will not be able to even develop a cataract. So you will not need cataract surgery.
And then let's talk about the actual procedure itself, whether it's refractive lens exchange, cataract surgery. Let's say somebody comes in, they find out that they're a good candidate, they meet with their staff, and then today's the big day. They're going to have the surgery. There's obviously going to be natural sort of anxiety and like what's going to happen? Is it going to hurt? Is it safe? Like, how do you describe that, what that process is like at our practice and how we help people feel comfortable? But what are they going to be experiencing? What is that surgery like? And what's the day after that or the day of surgery like as far as recovery, please?
Sure. So, like I mentioned earlier in the beginning, I started this practice and I got to design every step of it. And a lot of every step is kind of, going through multiple appointments and surgeries with my dad and kind of the things that I wish were better. Our clinic is a small clinic. We call it a boutique clinic because we really want to create a high customer service experience for our patients. So it's a smaller clinic and we have our surgery suite in our office. So patients are not having to go to another hospital to have surgery. It's all in our clinic. And we have a full operating room. And that means that there's no anxiety about where do I park, where do I drive. New staff, all of our staff is trained that works in the clinic side, that also work in the OR side. So they're familiar with all of our patients and what else is going on with them. We have videos on our website that show our facility, but it's really created to be like a spa-like atmosphere in the pre-operative area. So patients feel very relaxed. We don't even use an IV, so patients do not have to get an IV for our surgery. We do give Valium to relax our patients, but because they don't have an IV, they can eat up to 2 hours before the surgery. There's no poking and trying to get that IV access. The surgery itself is about 10 minutes. And during this surgery, you're going to lay flat on your back on a very comfortable cushioned bed. We have supports for your knees so that your back is not uncomfortable laying there for 10 minutes. And then after the surgery, or let me go back to where during the surgery, you're basically feeling cold water, some pressure changes, and some lights above you. You never see any instruments coming towards you. You don't feel or see the surgery happening to you. And then by the time you're feeling like, oh, I'm getting what's happening to me, we're done. Your eye is going to feel a little itchy, scratchy, and blurry for the first day or two, but will improve significantly afterwards. Your homework is to take some drops. We typically do surgery on Wednesdays, and we tell patients that they can kind of get back to most of their activities by that Monday. But even on the weekend, they can do lighter activities. We just don't want anything dirty getting into the eye, but they can kind of do all the things that they're normally doing. It doesn't kind of put them out for a whole week.
So I've got some questions coming in here. Rondell asks, with this procedure, will I still need to wear readers?
So it depends on the lens that you get, but most of the people that are getting RLE or even cataract surgery, we'll see if they have an option. If their eye is suitable to have what's called a multifocal lens, that's the one that allows you to get rid of your readers. If you are a good candidate and if we're using that multifocal lens, you will not need readers afterwards. Now, I tell patients that everybody can find something that they could see better with readers. So, an example is if you're in a dimly lit restaurant with very small font, you might feel like, could you read the menu? Yes. But would you feel more comfortable if you maybe had a pair of readers? For some people, the answer to that is yes. But for 90% of things that you're doing, you should not need the readers or glasses for any of it for that matter.
Olatunde asks, how long does the refractive lens exchange procedure last, the actual procedure? So is it you have to have it done multiple times, or how long does this procedure go for?
No, so once we take out the lens, there's no more lens to take out, so you're done. The lens implant itself, it does not need to be removed or updated or anything. It stays in your eyes, and I always tell patients it gets buried with you. Now, as far as like, is there anything else that needs to be done? Typically no, but as we age, people get some other things that happen. So it's not like you don't need to get an eye exam ever again. We still need to follow you for things that are not a cataract issue or a lens issue. But the lens is no longer a problem. A cataract is no longer a problem once we've removed your lens with the refractive lens exchange.
Robert asks the question, is there a procedure for glaucoma and nearsightedness?
There is, so it probably not the same procedure, but even having cataract surgery can decrease your eye pressure if you have glaucoma. It depends on all the severity of the glaucoma. And sometimes we do a combined procedure of taking out the cataract and treating the glaucoma with something called a MIGS or a minimally invasive glaucoma surgery. But it all depends on whether you have glaucoma, how bad it is, what your pressure is. So we would discuss all of that with you.
I have a question here. Is the cataract surgery done too often, like just like the C-section? Interesting question. What's a
So here's the thing. They're completely different surgeries. And it's a completely different kind of scenario or question. Cataract surgery is the most common surgery done in America. Now, if you just think about it, it is like everyone as a birthday gift, as you get older, that cataract is coming. And it comes at different times for different people. And it's really a matter of if you're getting cataract surgery, whether it's bothering the patient, whether the surgeon feels like it's a bad enough cataract to remove. But refractive lens exchange has really changed this whole idea. People are choosing to get the refractive lens exchange. It's not like we say you have to get it. And they're choosing to get the refractive lens exchange before they have the cataract because they don't want to wear the glasses. It's a different scenario. It's more of an elective procedure instead of like something you have to get. Even cataract surgery is an elective procedure. There's a discussion on whether you want to get it, whether you need to have it, and what do we think your outcome is going to be.
I wanted to pivot and talk about lens options. I know we have a variety of different lens options at our practice, and wonder if you can kind of carry us through what we have on the screen here, or just talk us through the different lens options, the light adjustable lens. Like, how do you kind of speak that through to a patient so they understand how we customize the approach for them, please?
So there's technology is always changing and improving. We think that we've made so many humongous advances in cataract surgery from even when I was in training and the lens options that's available, which is a wonderful thing for patients. And so we always are looking at what are the different options that are available today and what are the patient's goals and how do we get them there. So just by having a cataract, it's going to cause yellowing of your vision, kind of blurring things, maybe causing the glare and things like that. When you choose the standard or basic lens that's covered by insurance, that is for one distance only. So if you either pick distance or you pick up close, based on what your natural prescription was. But for all the other distances, you would then have to wear glasses. Now, if you have astigmatism, that basic or standard lens does not correct for that. So you would still need to wear glasses just to correct the astigmatism. Now, for people that are choosing that they don't want to wear glasses afterwards, then the lenses would be considered an upgrade, which is a multifocal lens. We have something called an extended depth of focus lens, and we would discuss the nuances with you based on what your vision looks like. But those are the options for not having to wear glasses afterwards. So it's kind of like I'm having this surgery and
Yeah.
I want to, treat myself to not having to wear glasses, or I want to upgrade while I'm going ahead and having the cataract surgery. I want to give myself these other options. So it's an elective choice. You mentioned, Michael, the light adjustable lens. That's a customizable lens option. That's the only lens available right now that can be customized after it's in the eye. And those are, we use it for a distinct population in that they have these specific goals, or they have some other things going on in their eyes that don't make them candidates for multifocal. We'll choose this lens. And the huge advantage of the customizability is that you kind of get to try your vision before
Yeah.
we lock it in. And so patients will have this surgery, try and see how their vision is, and say, I want more clarity for distance. I want more clarity for near, or I want to see my computer better. It's very specific reasons that we tailor that prescription to. And then we'll treat it with a light treatment that's done. It's not multiple surgeries. It's a light treatment that we do in the clinic while they're sitting upright.
And then, as far as like the after the procedure, how quickly are people going back to their regular activities? Any limitations on activities you wanted to talk through, please?
Sure, most patients, like majority of your activities you can do. We're just not having you like clean out the garage right after
Yeah.
surgery, or, break any weightlifting records. We want patients to take it easy for about a week, but they can go around walking and like even go back to work, things that depends on what they do, but they can do the majority of their activities. We just don't want dirty things or significant like strenuous activities to be occurring for at least the first week after surgery.
And then the question about astigmatism is, can refractive lens exchange or cataract surgery treat it? But maybe we could start out with what exactly is astigmatism, and then we'll talk about if it's treatable, please.
Astigmatism is kind of like your eye being shaped like a football instead of a basketball. And if it is, what we call a regular astigmatism, meaning it's a smooth football, then we can make calculations and correct for that astigmatism, just like you do in your glasses. Whether you know it or not, if you wear glasses, your astigmatism is always at least being measured each time you get a measurement for glasses. And now, if we think that it's not a regular astigmatism or more of a lumpy, bumpy football, then we may not fully be able to correct that astigmatism with a lens, just like we wouldn't be able to correct it with your glasses. But we can oftentimes correct a lot of it. And so the patient's vision would still be a lot better without glasses than they've ever had before. But we would need to, that's why we measure with multiple devices to really get an idea of the character of a patient's eye, then recommend the best lens implant for them and their goals.
I've got a few people here asking about insurance. Olatunde asked that question, and then Robert as well. A few other people are asking what's covered by insurance, what isn't. So I'll start out, and then I'll let you round it out. Refractive lens exchange is an elective procedure, so that's something that people are doing. They're investing that for themselves. Cataract surgery, I'll let you talk through when things can be covered or not, but we do have amazing financing plans. You can use your HSA, FSA coverage for the procedure, but I think the best first step for everybody is to come in for that initial examination where we can kind of find out what's going on with their eyes. But How anything you wanted to add on the insurance side or how we talk that through with patients, please?
Sure. So insurances have specific criteria, and they're thankfully for the most part pretty uniform across the insurances. So we always, as part of the examination, we always measure everyone to see if they would meet insurance criteria for it to get covered. If you don't meet the criteria for insurance to cover your surgery, then we would tell you. And in the case of a refractive lens exchange, that means that you're either you don't have a cataract or your cataract is not bad enough for insurance to cover it. And in that case, it would become a refractive lens exchange. Again, the surgery is exactly the same, but it's about how severe things are and whether insurance would cover it or not. And then we would, like Michael was mentioning, we go through a lot of effort to make sure to try to get you the best cost estimate. We contact your insurance to let you know all the costs as best as we can get them from your insurance up front, so you know what it's going to take and whether you want to add on a upgraded lens implant at that time to see if you can get out of your glasses. And there was a question about when do we recommend the evaluation? We have two different evaluation options. There's a virtual option that we'll learn about you, ask you questions, kind of see what your history is, and can gauge a lot of things from that, as far as what's bothering you and what we think would be an option for you. Before we do any kind of surgery, we would have to see you and evaluate you in person. So some people will move just to that step with the in-person evaluation, and some people want to kind of get a little more information before they come. So those are both options available to patients. And then as far as the timing of an evaluation, it's really like when you're bothered enough to learn more and you're curious enough to see if it's the right fit for the issues that and the challenges that you're having. So evaluation does not mean surgery. It just means we're going to evaluate you and see what where your eye is at and how your vision is, and make recommendations based on that.
Yeah, Rondell asks, with regards to insurance coverage, would this be considered a medical coverage or would separate vision insurance be necessary?
If it is a cataract and we're going to do surgery for cataract, then it would go under medical insurance. And then most vision insurances do not cover like they wouldn't cover LASIK, they wouldn't cover RLE. It would just all be out of pocket. But as Michael was saying, HSA funds can be used for that.
And then just to talk us through anything as far as like next steps on, I guess we should talk about where we're located just to be helpful for people and then sort of what that experience is going to be like. I'll put up on the screen sort of that next steps on what they can do, but talk us through that next step of the consult. Where are we located and what's going to happen, please?
We're located in Peachtree Corners, which is a northern suburb of Atlanta. We are in the Forum Shopping Center right above the Trader Joe's, so it's very convenient. A lot of our patients stop by Trader Joe's once they're done. And as far as the evaluation or next steps, you can just give us a call and we can kind of walk you through what our next steps are. There's also an opportunity to go on our website and request a call or an appointment. So there's a lot of ways that you can reach us. We also have a lot of information about cataract surgery and refractive lens exchange on our website. So if you wanted to learn more before reaching out, but it's quick and easy to call us, and we can take you through the next steps. You can, like I said, do a virtual consult or do an in-person evaluation.
Well, ladies and gentlemen, we like to keep these at around a half an hour. I'm going to give one last chance for anybody if you have any questions to ask them. Let me see it. Actually, here we have one in from Olatunde. How aggressive is the lens damage in cataracts in somebody with this just being detected on a scale of 1 to 3?
Sure. Typically, we grade cataracts 1 to 4, and a 1 would be mild. The 4 is the like a brown, very mature cataract,
Yeah.
but 1 is mild.
Okay. Zena asks me over here, what are some of the common side effects? Anything that talking through short-term, long-term people need to be cognizant of with this procedure?
Sure. So just like when you get a new pair of glasses, you're changing your optical system, and so your brain takes a little bit of time just to get used to it. But most people, it's not much because they see so much better, and the brain always wants to see a clearer picture. Now remember, your eye is just a light transducer, and you actually see with your brain, and that's why there is this what we call neuroadaptation period for patients. It was sometimes with after cataract surgery, but like I said, it's very quick. What a lot of patients, their side effects would really be based on what type of lens they pick. With the standard lens, there's not as much glare and halos. And so the big thing that we talk about to every patient about with a multifocal lens is the glare and halos that they could have at night. And those are different than the glare and halos from cataracts that kind of scatter in 360 degrees. These are kind of like little rings. And 90% of patients after 6 months from having had the cataract surgery really do not notice the glare and halos with the multifocal lens. But we go over all of that with each patient and just also like taking into account what else is going on in their eye.
Annie asks, how does this procedure affect RP?
So I'm presuming with RP, it's retinitis pigmentosa, and that is a hereditary or degenerative retinal condition. And with a lot of those patients actually do get cataracts as part of normal progression of their disease. It would limit the type of lens implant options, but not preclude anybody from having cataract surgery. We do cataract surgery on patients with RP all of the time, and it can improve their vision because their vision is so significantly affected by the retinitis pigmentosa. Adding that extra light after removing a cataract can really improve the quality of life. Cataract surgery, and I 100% realize how biased I am, but cataract surgery can really make a huge impact on just about any patient's eyes, regardless of what else is going on in their eyes, because it's like when you turn up the brightness on your phone or your computer, even if things are blurry, by just adding more light and brightness, you can see your screen better. You can see your phone better. And that's basically what's happening no matter what's going on in your eye when we take out the cataracts.
Awesome questions, everybody. Really appreciate it. I want to kind of round out our time here, Dr. Patel, and give you the sort of the final word. But I want to thank everybody for the amazing questions and also just spending time with us here on your lunch hour. Any final words you want to give to everybody, please?
Sure. I once again thank you for your time. I hope you found this to be helpful. We do we're offering this again next month. If you have friends and family that couldn't make it today, you guys should all receive a recording of the webinar. So you can also review that or send that along to friends and family that are interested. We have tons of information on our website, and also just feel free to give us a call, and then we'll help you take the next steps and help you find what's best for you and your vision goals and your lifestyle.
Excellent. Ladies and gentlemen, if you have any other questions, just reach back out to us at the practice, and we'll be able to take excellent care of you. Thank you so much, Dr. Patel, for your time. Everybody have a wonderful day. Thank you.